You introduced Botox in India in 2000. How did people react?
Their first fear was needles in the face. Only celebrities use it. A stigma around it. Total taboo. And they told me, डॉक्टर साहब हम जब सुबह उठते हैं हमको न्यूज़पेपर ऊपर पकड़ना पड़ता है because हमारे eyebrows नीचे आए हैं. Let me give tiny units that we need to give the touch-ups every 4 months, but you're always looking natural. When I brought Botox to India, there was no one to teach me. Even the distributors came 3 years after I brought Botox, and we would like natural look all the time.
To what extent do aesthetic treatments boost confidence, especially for women who are over 40 years?
Around 40, the estrogen starts declining. The cell renewal slows down.
Are there side effects of Botox and fillers? Because when you use it can damage your liver or your kidney.
No, it blocks, and that prevents the wrinkles from coming.
Is it too late to start any cosmetic treatment once you're in your 40 or your 50?
Not at all. There is no age bar. I have clients from age 18 to 92. Nothing is permanent.
What about hair transplant?
Hair that is transplanted is permanent.
Welcome to Perception and Beyond, the Suman Agarwal show. In today's episode, we are joined by Dr. Jamuna Pai, the pioneer who brought Botox and aesthetic skincare to India. We'll dive deep into how these treatments impact self-image, aging, hormonal acne, pigmentation, and even mental well-being through appearance. We'll also talk about skin confidence after 40, preventive care, and what really works in a world full of beauty myths. Before we begin, don't forget to like, share, and subscribe for more empowering conversations. Hi, Dr. Pai. Welcome to
Hi.
Perception and Beyond.
Thank you for having me over on your
And
show.
it's such a privilege to have you here.
I'm so excited, actually.
So I wanted to ask you, you introduced Botox in India in 2000. That's such an amazing thing because you had the first mover advantage. How did people react at that point of time, and how was the mindset of people around aesthetic treatments, and how has it evolved over a period of time?
I had a great purely aesthetic practice from the year 1994, realizing that it is science-based. So then I said, why not get a little bit that is different in India to India? So I went abroad, and that time, frankly, they had just started off with using tiny machines for facials and, for deeper penetration of the actives that were used at that time. I'm talking about 31 years ago, 33 years ago, because 2 years
Right.
before opening. So I came, with those little equipments, and there wasn't even laser that time for hair reduction, which is today such a common thing. We were doing hair removal with electrolysis. You're right. So electrolysis was, it was, you really had to be specific, otherwise you could burn a skin. So luckily I trained there. I came back, with all these diplomas and certificates, very excited. And the only things from 94 that we did till 2000 was facials, a little different with these little gadgets. We treated acne and acne scars. We treated pigmentation and hair fall. That's all. There were no injectables. Then there was no lasers. So in the year 2000, my practice was large because there was no one doing aesthetics by a doctor.
True.
So I was asked by the American company, that was Allergan then. Today it's a part of AbbVie. So they asked, one fine day I got a call. I always believe that everything happened at its own time. I believe, I'm a great believer in that. So I said, I got a call out of the blue saying, we hear that you have a great aesthetic practice. Would you be interested? You're a doctor. Would you be interested in starting Botox in the country? So that excited me. I'm a very, impulsive. I take decisions on the spot. My husband was very cooperative. We have our trainers all across the globe. So you'll be trained there. So my husband and I went to their training, center. And in one day, he went through. There were very few indications then, and they were mainly Botox for the upper face. And I came manned with all that information and feeling happy. And they gave me one vial of Botox. One vial of Botox, it's 100 units of Botox. you won't believe. When I came and I spoke about it to my clients, who already they had a good client base by then in 6 years, and their first fear was needles in the face.
Right.
Then, my God, what about the pain factor? And of course, I could not explain these are insulin, hair-like needles, etc. And the pain. Oh, only celebrities use it, when they need to, and a stigma around it, total taboo. So to break into their, thought process was very difficult. One while sat in my fridge for I can't say how many months, and very few, maybe friends, family members dared to take because I said so. So that was how it was then. From then to now, after 3 decades, if you're asking me, today there are clients, of course, there's a lot of awareness. There's a lot of, wanting to have that look. If it is giving me a fresher look, if it's making me look younger, people want to try. But I can't tell you how much awareness there is that a client walks in and she says, can you do this? And can you do so many units? And it is amazing how the transition, how the evolution has taken place, especially with Botox. Some people thought it was toxic, some people thought it was, so there were a lot of apprehensions initially, which now, thanks to Google, Chat GPT, when I
Yes.
brought Botox to India, there was no one to teach me except that one training. There were no vendors. Even the distributors came 3 years after I brought Botox into India. So I had to
Wow.
make my mistakes as
And
per
learn
what I
from
was
them.
taught. I lost some clients, but over a period of time, we realized that their protocol and our Indian protocol is completely different. And we would like to have a natural look all the time.
So you have been a pioneer in the aesthetic industry, and I have been a pioneer in the industry of image consulting. We both have first mover advantage, but at the
Of
same
course.
time, we have also made our share of mistakes and learned from them.
Of course.
And at the same time, after learning from those mistakes, we have only made things better
Of
for
course.
the
For
others
others
who
to
have
follow.
followed and who have now started the same industry. So we still remain pioneers.
Absolutely. There's no doubt about that.
And of
Because,
course, that is why it is difficult for all of us, like people like us, because we don't have any fallback option. We don't have anybody else to tell us what to
tell
do.
us, no mentors,
So
no,
we only
in this,
learned from what we did,
and
and we
did wrong.
unlearned and then moved on by making certain mistakes
Absolutely.
and then making things better for other people.
So when I went, I told you, when I went to learn these little gadgets, and it was a training session, but they said we can make it as short because you have the medical, knowledge. So we'll teach you only the beauty aspect. But the models that came in, we work on models. Like when we have training sessions in injections, we have free models coming in. The models that came in, first of all, were very old. They age faster than us. And we had to actually lift their skin to do the anti-aging treatments. But more than that, the energy is used, for them, for their skin, because they are devoid, their skin is devoid of melanin, which protects us, which most people don't like, they've come to accept now. But that is what protects our skin. So we don't need that depth of, energy to penetrate that level for correction of wrinkles or for any other thing. So I learned at that energy levels, came back to India,
Unlearned
use
that.
that, yeah, use that, causing post-inflammatory hyperpigmentation we get because the skin heats and the melanin, which they don't have, comes up as a protective mechanism. And so instead of lightening, we are landed with something else, and maybe sometimes darker if you're treating
Correct.
pigmentation. So I had to kind of unlearn. There was no one to teach, frankly. So I had to unlearn, go very low on energy, maybe give 1 or 2 sessions free because I was learning on her. But there were times when these things happened in the beginning, and I lost clients, like I said. I had to handhold till they got well. So all this, like you said correctly,
Absolutely.
yeah,
And
we
and that's
learned.
such a um, humble approach of you accepting that you were losing clients because of the
Yeah,
mistakes that you
of
made,
course.
because you learned on a Caucasian skin and then you
Had to.
unlearned because you had to do certain things on Indian skin, and that was
Right.
such a big gap that you had to,
Yeah,
manage
right.
and take care. And you are practicing in India. And when you learn something abroad,
Yeah,
the skin tones are very different.
absolutely different.
So many
And
challenges.
we are
but
protected by our melanin,
Of course.
of course. And so that though people feel that, oh my God, we are brown or dark skin, but that is what prevents our aging faster,
That's been a blessing for us.
Yeah, blessing for us. And as long as it is even tone, as long as it is blemish free, I mean, an olive skin, a brown skin today is largely accepted, even internationally, loved. In fact, you know that I'm a Miss India. I'm on their expert panel for 30 years now.
Wonderful.
So initially, their concern was always that, a brighter skin, and because they were thinking that they are competing with the Caucasians, the Western world. Then came a time that all the winners were, kind of dark skinned. They were uh, not winners, not from India. I'm talking about on the international platform. The ones that were, they always liked dusky skins. And then we realized, and it was decided between that skin color we will not. If they have marks, scars, patchiness, make it glowing. But our skin color, Indian color, is loved. The golden hue
True.
is loved by everybody, and we've been getting crowns galore since then, international.
Wonderful. What inspired you to bring treatments like Botox, like you just mentioned? Was there anything that you wanted to do different in India, or this is something which you felt was like a one big solution for people to look young? Was there anything that came in your mind when you actually thought of introducing
No,
this?
that call that came was out of the blue, and but I'm always, like I told you, it was a known company internationally. I read. Of course, there was no Google or anything. So what they explained to me on the mail, and I said, why not? Why not go? The West definitely is more progressive. Why shouldn't I get a treatment here, and try it out and see what happens? Now, when they are talking about training, for example, upper face protocol is 64 units of Botox, the company protocol, for example. And when we do 64 units of Botox, the first 2 months you're all like this, because your eyes, you've used 12 units. We use 3 or 4 units on each side, and they've used 12 on each side. They have used a whole 20 units on the forehead. So that brings the eyebrows down. So this whole thing of this glabellar complex where people have those, frown lines. So this whole thing, 64 units. But when I came back, of course, I practiced 64 units. I must tell you something funny, that we practiced 64 units because I thought that was what was meant to be done. There was no one to tell me otherwise. And there were these, in the older age group, I'm sure they were younger then than me. But coming back to, they took, two of the friends came and took Botox and went. They must have been in their late 50s, 60s. And they called me about, it takes about 7 to 10 days for it to show. And they told me the next week, the doctor Saab, because it was not, awareness was not there. डॉक्टर साहब, हम जब सुबह उठते हैं और चाय पीते हैं और न्यूज़पेपर हाथ में पकड़ते हैं, जैसे हमको न्यूज़पेपर ऊपर पकड़ना पड़ता है. क्यों? बिकॉज हमारे आईब्रोज नीचे आए हैं. Because this is an elevator, this whole forehead muscle. So it's an elevator. So when you give Botox, the elevators becomes depressors, and the depressors, like from the eye, the eyebrow, it becomes elevators. It's just it relaxes and does the opposite. So when we give that many units, though we use the depressors to lift our eyebrows, etc., we gave so many units here, it kind of brought it down, and their eyebrows came right down there. So obviously it was a hooding, and so what we would read like this, they had to read like that.
Oh my God.
So I had to think, why would that have happened? Before anatomy was taught by the company more than 3 years later. I had to go back to my anatomy.
3 years you had to actually
Absolutely.
manage on your own?
Absolutely.
Oh my God.
They celebrated my 10 years, and they celebrated the company's 10 years when I was 13 years. When we were 13 years in practice. 3 years later, they came in. And then Botox, the people started using. So in the aesthetic world, I had a 10-year lead, more than that.
Wow. And you had to do a lot of learning on your own.
Oh my God. Then I realized, let me give tiny units and see how it works. So the thing is, when you give 64 units, it will last you 6 months. But the first 2 months, because Botox has a way of wearing off on its own, it gets degraded. But the first 2 months, you're like this. And then once it wears out, you start looking normal. And then, of course, you need a touch up. But when we gave lesser units, we realized that we need to give the touch ups maybe every 4 months instead of 6 months, but you're always looking natural.
True.
You're always looking a fresher version, a younger version, a better version of yourself, and you like it. Nobody's asking you, "Aapne kuch karaya hai?" They just say, "Oh, your yoga is helping you so much."
So you learned it the hard way.
Very hard way.
Yeah. So, to what extent do aesthetic treatments boost confidence and self esteem, especially for women who are over 40 years?
Yeah, over 40 years. Now, around 40, the perimenopause stage starts. So, from 20 to 40, the estrogen is at its highest level. So, that's when you conceive, when you get your kids and all that. At 40, post 40, it starts declining. Now, estrogen is the hormone that gives us our youth. It keeps our skin elastic. It does so many things, for us. Now, as the estrogen comes down, we realize and we see, or that is what science tells us, that the collagen and the elastin, which is the matrix, the supporting, ground substance of our skin, so that becomes thinner. The inflammatory things that are happening, the free radicals, the oxidative stress, is making it more brittle.
Mm-hmm.
Okay. So, obviously, when it is brittle, it breaks easily. So, you start seeing fine lines and you start seeing this. Then there is that in perimenopause, the cell renewal cycle slows down. In fact, a little later, because when you are younger, when you are 25, it is about 25, 27 days cycle, 28 days, almost a month, you say. And as you grow, like at my age, it would be more than 2 months that my cell will regenerate and a new one will take its place. So now, if I have dead cells lying on my face for more than 2 months, my skin will look dull.
True.
A good skin that I've inherited will look dull. So then I need small treatments. So that is one of the things that happens. The cell turnover, slows down. And so there's a stacking up of dead skin cells. And of course, your metabolism goes down. So when the metabolism goes down, your as fat increases. So you see slowly, not in the early 40s, but you start seeing that the fat accumulating, despite your lifestyle being the same, your food being the same, you see fat accumulating. And so there's a lot of insecurity. And have I done something right? Is it time for me to start certain treatments? Also, about 45, between 45 and 50, that is a time that children find their wings and then they go abroad, they go to universities, the parents whose life was completely around them, and then the husbands are busy because they've reached the peak in their career. So if you see, the woman just feels that, oh my God, nobody's looking at me. I don't have much to do. She has more time to look in the mirror. She feels first time she sees her lines or a patch appearing because she's in her 40s, because pigmentation patches do appear in women who have outdoor activities, etc., even otherwise, if they are prone to it. So all these the oxidative stress, the free radicals that are not removed from the body, they also show up in the form of light pigmentation. So they start noticing this at the first time, and there's a lot of insecurity that they feel that till in our clinic, the first hour we talk to them. My assistant doctor talks first, ask them what their primary concern is, and then we talk about, today there's a whole lot of them in our magic box that we can offer them. So suppose they don't want injectables, no injectable. They want tightening this thing, because the superficial fat pads that are just below our skin, all over the face, even in our forehead, they start coming down with age, gravity as well as aging. The ligament that was holding it in the deeper layers loosens, like everything else loosens, and this comes down in the form of jowls. They don't like their jawline because that gives away age. So loosening or slackening, the fat pads also, which are affected by the estrogen coming down, they start, and thanks to gravity, they start coming in a comfort zone and they cause the jowls. So the sharp definition of the jawline is no longer there. And they want that also to be addressed. And overall, it is not such a happy place. And then when we, like I told you, first 1 hour, 45 minutes to an hour, they talk. They take all their history, their medical history, and what nutritional supplements, how much exposure to the sun that they have, because we need to know before we plan their treatment. Then they're brought to me, and the history is, kind of told to me in short. And then I ask the client directly. Then I add in my things which are put into a prescription. Then the prescription is, each word of it is kind of explained to the client. And of course, a number is given so that she can get back to us in case of any, because we have spoken to her about so much. But it's very important. And that, again, I learned the hard way, that whatever concern that they come with, the primary concern, that's what has to be tackled with first.
So do you deal with people who have been in a situation where they are very, very underconfident because of the way they've started looking all of a sudden, and then
Yes, of course,
you have been counseling them and telling them that this can be taken care, we can address these issues? Have you had these kind of people?
Oh, plenty of them. I mean, over 31 years, you can imagine how many. I mean, people of different psyches come in. So many people are just confident and happy in their own skin. Never mind the patches, never mind the gray hair. Today it's become very popular, just sporting your silvers in the hair.
Right.
But yes, so many of the others, they do feel absolutely not so confident of themselves, that they feel that there's so much out there that they can, take advantage of and be like someone else that they admire. Though all the time we tell them that we do not want to look like someone else. We want to look the best version of ourselves. And in that, I will tell you what we can do for you. Having a nice glowing skin in the years of, I mean, I'm blessed with a good skin. I keep telling, when I talk about a treatment, I tell them, ye karke mera skin aisa nahi hai. I said, I'm blessed with a good skin genetically, but आपको अगर skin quality ठीक करना है, that is very important, because that in itself, आपके features भी टेढ़े मेढ़े हो, suppose,
Yes.
It's okay. But if you have a nice glowing skin that reflects your internal health, we'll come to that. Your internal health, your sleep, your nutrition, your emotional balance is all that is reflecting. And of course, exercise, very important. So if all that is there and we are helping you with a little bit of tightening, with a little bit of peels, with a little bit of home remedies that you can do to take away that exfoliation and keep your skin dewy, we'll tell you what your morning routine should be in 3 steps and 2 steps in the night after you cleanse. And you have a beautiful skin, your confidence levels go up. So we have pictures from when they first came to us, over 4 to 5 years, over 10 years, we have their pictures where they don't look different, but they're looking so much fresher and younger, though they have aged 10 years.
Dr. Pai, we often talk about women and beauty standards.
Yeah.
What about men? Because everybody is under this impression that it's only women who are very aesthetically conscious and they come for treatments more than men. Is this true, or even men seek beauty treatments when it comes to looking good and feeling them, confident about themselves?
Okay. Now, before giving you the numbers and all, you tell me, do you see more and more men who groom themselves well, and you are in the image consultant business? So what do you feel?
I think people have now, especially men, have also now become image conscious. I would not know about your industry, but definitely in image industry, there are men who are more, consulting seekers, service seekers.
Correct.
Than women.
Correct.
But in your industry, I think you have to tell me.
Suman, when we started, we said, oh, this is going to be, because it was something so different that I was doing. So I said, this is only a women's arena, beauty. So then only women, patients or clients that I call them, and a full women force of 6 of us, including the girl who cleaned the place, a small clinic. We started that way. But over a period of time, let's say about 6, 7 years down the line, there were mothers who came for treatments and they said, my son has acne. This is a only women's clinic. So can I get my son? I said, of course, acne, a teenager, please do get him. And so the trend slowly started. because acne in their puberty and their early 20s, we were treating acne. And I said yes. And so slowly the numbers increased. Later, the women said, "Can I bring my husband?" And of course, that was because at the behest of the wife that they came in and got their treatments done. But today, if we are looking at whether they're doing Botox, whether some of them are doing even lips, whether they are getting their chins altered, I mean, just to suit the macho image, whether they're getting their jawlines, kind of made sharper or made stronger, because men with stronger jawlines are considered to be that much more superior, so to say. And some people even come, men have a more squarish face, and women, today even women like a little bit like Angelina Jolie and all that, a little bit of, you can say, a width here. But men definitely like it. So if they don't have it, we have fillers, strong fillers, which stay for a longer time to give them that squarish look. So, and another thing that they come for, of course, main thing I forgot to tell you is most of them come for their hair because they have thinning of hair because of genetic factors. They have 3 or 4 generations of, before them that didn't have good hair, or they didn't have hair at all. And so, frankly, we have treatments for that to retain whatever they have. Because if they come at a very young age, for example, if in my husband's family, they had that all along all generations. So my father-in-law, for example, I saw him. He just had that little rim and no hair there. After that, 3 sons, including my husband, all 3 of them identical. After that came the next generation, that is my sons, same problem. So the thing here is that those who have hair, so if you're in your 30s, 40s, you'll be able to tell them, or if they are in the glamour industry, that hair transplant is the only thing which is permanent, which will make you happy, which will give you the image that you're thinking of.
Right.
But if you want to maintain in your early 20s, if you want to maintain whatever you have, stop the fall, increase the width a little bit so that the volume looks bigger, then we have beautiful results. So we use our PRP, we use the GFC, we use the Morpheus 8 with all these exosomes, the PDRN, all these new regenerative medicines, and we use it topically, and they do get some improvement which they are happy with, because even though they have donor hair, they are not kind of I should say that we should keep it till a point that they really need, not explore that option right in the beginning in their early 20s.
Right.
But that is one thing that they come to us, so we do those treatments in plenty. And another thing that they come is nowadays, as you have seen, all the youngsters, even we don't know what is middle age, what is aging, but all of them like to sport a beard. Some because their jaws are sagging, so they want to cover it. So they have this salt and pepper beard, and it really looks nice. At least I personally like that look. But when they want to get it totally sharpened and identical, I mean equal to both sides, they do come in for laser. They opt for laser. In fact, in my Dubai clinic, which everybody has a beard, and then they want those straight lines, so they come for laser hair reduction.
Oh, so they get it designed that way.
Yeah, yeah.
Oh, wow.
Yeah, we do it in our clinic also.
Lovely.
In fact, even men who have too much of hair on the chest and the back, they are conscious to swim, and so they come with those this thing. Or if it is very thick, and if they're trying to even shave and all, sometimes they get these ingrowths, these little bumps, folliculitis. So then we definitely help them to reduce the thickness of the hair with the laser.
Wow, I never knew this. So what is this exosome therapy? I have not heard of this before.
So this is all part of the regenerative medicine, which is the big new thing on the block. Now, exosomes are extracellular. That means they're not within the cells. They are extracellular particles that are either we make microchannels in the skin with our microneedling or our derma pen, etc. That means we go deeper, and then we either spread this or we inject it with tiny needles into the area. Suppose for the hair also we have exosomes. You can use exosomes anywhere because they are giving signals to the aging cells, to the sick cells, generally to repair, regenerate. And so this is the new kid on the block. But at the same time, I have to say that though we are showing before and after results, though we are saying after 4 sittings, look, there is a change, we do not have evidence. And unless there is true evidence, like Botox, it was started in the early 70s, and today we have over, let's say, 50 years of evidence base, lots of articles written, lot of indications, lot of protocols for injections. So we know it is evidence based. Now, these things being new, but yes, if you ask me, are they result oriented? Do they do this thing? Are there studies? Studies have started. That's why we are using it in our clinics.
Absolutely. And Doc, I've heard, I don't know how true it is, are there side effects of Botox and fillers? Because I also heard that when you use Botox, it can damage your liver or your kidney. Has there been any kind of side effect like this?
No. So now that is a beautiful neurotoxin. It was used earlier. It was founded by a duo. One was an ophthalmologist and the other one was a dermatologist. Now, the ophthalmologist used it for squint, for any other ocular problems that they had. And these clients, when they came back, they came and reported that, doctor, yes, it is improving, etc. But the one thing that we are finding is that our lines around the eyes are reducing. And so the dermatologist partner decided, they're Karuthas and Karuthas, they decided, they've written lots of papers from then up to now. They attend our conferences. And so they started work on doing, working on the upper face where they were doing their injections. And they realized that definitely the wrinkles are going, but they are reappearing. That was the best part, because the neuron that is blocked, the neuron, that the nerve ending that is giving the sensation. For example, I want to smile, my nerve ending is giving from the brain. I'm happy, the brain is sending a signal to that muscle, and I'm smiling. Okay, you can see my fine lines. I don't want these lines. So what happens is I give Botox. It works on that. It blocks the neurotransmitter acetylcholine, and that prevents the wrinkles from coming. So you feel fresher there. So they did lots of studies there. So unless maybe you're using a poor quality product, maybe the person introducing the treatment or giving you the treatment does not know how to do it. So unless all these things happen in 50 years, it is only either an anatomical variation that causes a problem. We are all not, your vessel, which we are teaching generally, is about 67 to 70% the same in all individuals. But the remaining 30, some vessels may end here and you don't know. Some people have undergone surgery, their vasculature changes.
Correct.
Fillers can't be put into vasculatures, into blood vessels. So, but we are taught the path, so we avoid. There are hundreds of classes and modules and conferences that I attend. I teach. I just came from Monaco. There again, we learned so many new techniques of doing these things. And yes, so no problem with any organs. There is nothing that happens over a period of time. People, even with lesser doses, the muscle is used to contracting less and less. So even with lesser doses, they look nicer. So
Amazing.
really there is, and fillers and Botox are completely different. As many people, even today, after so many years, after Chat GPT, after Google, and everybody's training them, they do not know the difference. So they come and ask, "Acha, ye Botox de rahe ho?" So we say, no, this is a dermal filler. But I have to tell you something which I feel the audience will benefit, that the fillers, it is a sugar molecule actually. So it is made with hyaluronic acid, which is the ground substance of our own skin, and which gives the bounciness to the skin. Okay, that's why our in later years, when the hyaluronic acid is less, the skin becomes brittle. Okay, so now we have injections which are just skin deep to give that hyaluronic acid back.
Okay.
And so you can get that nice glow and the bounciness again. So really, it has really grown so much.
Evolved
Evolved over the years. Now, coming to dermal fillers. So recently, this was the Monaco trip in March that I went, March end. I presented the same after doing my research, and there was another doctor from Brazil who also had the same this thing, pictures, for example, of Madonna, who's looking completely different from such a beautiful woman. What happens is that the fillers, though the company does mention that it lasts only for about 18 months or sometimes even 2 years, definitely they do remain. Suppose there are many doctors, we don't give more than 2, maximum 3, if they need all over the face.
Mhm.
That is how you need to be artistically inclined. Like I say, a doctor is definitely certified to hold a syringe in their hand. Doesn't mean that doctor is an artist.
Correct.
Yeah. So the doctor should know where, when they put, will enhance the look, make them happy, make them a better version of themselves without making them look like someone else.
I think the most important thing over here is that if you don't look aesthetically put together yourself
Yes.
as a doctor, it's very difficult to have that faith in you, because
Correct.
a patient will always see the doctor and then have that belief, because primarily, it's always the person who you want to become like.
Correct.
So if
We
a
are
doctor looks
inspiration.
like
Yeah.
an aspiring doctor who is well put together, who has great sense of aesthetics, and it can be very well made out by the way the doctor carries herself or
Correct.
himself. Once that is in place, a lot of belief starts coming in the patient also.
Yeah. A lot of confidence.
And I
in-
think here
and the
also
trust.
image consulting and aesthetic come together, because if an
Absolutely.
image consultant herself is not looking well put together,
Absolutely.
how would this person find solution or give recommendations to a
To
person who has
others.
come to them?
Yeah. Who has come to learn from them.
So
Yeah.
that's also very important, because that belief will not come otherwise.
Yes, true. Absolutely. So then, so that is one thing that someone says, how would you choose your doctor? But I want to finish that earlier point where I said, we all realize, both of us doctors who presented, that the fillers stay for much longer.
Mhm.
So if you have taken, we have charts that we maintain, we have all those numbers and everything. It's very nicely done legally, medico legally. But if that person has taken 4 syringes, say in the last visit, we'll see if a part of it, because a part of it is always remaining. There are fillers that have lasted from 2 years to one client in the study that lasted for 15 years.
How?
15 years. I mean, not all of it, not all the 3 syringes put, but a part of it. So in the studies, it shows that it can last. And that is why when these celebrities or other people, you see a lot of normal people, I see a lot of them in Dubai. But even in Dubai, where they used to have the puffy cheeks, where they used to have the fish like the trout pout look for lips, long lashes, all of that has reduced. So people have realized that that really does not look beautiful.
Correct.
Yeah. So it is for us to tell them that no, I'm not going to put more. You want a little bit is left of this syringe. I'll put it in the chin where it'll make a difference. I'll put it under your eyes where your tiredness will, look less. But you look like a fresher version of yourself. You look like you, not someone else.
Absolutely.
Yeah.
So, tell me a little more about this hyaluronic acid, because nowadays we keep hearing a lot about retinol,
Yes.
hyaluronic acid. So, where and how are they used for a normal person?
So the retinols, there are various, variants of retinol.
Mhm.
So, but retinol is my most favorite. When I wrote the book 11 years ago, I wrote in that also my most favorite molecule being retinol. Now, retinol is a beautiful molecule. I'll talk about it. My top 3 that you said: retinol, niacinamide, hyaluronic acid. Now, for retinol, it is very important. It works for just a nice glow. It works for acne and acne scars. It works in exfoliating, and so it works on pigmentation. It disrupts pigmentation, and it also works in anti-aging because it is, over a period of time. Now, the thing to know about retinol, you need to initiate your skin. First, do a patch test, either near your neck or, behind your ear, and see that if it suits you. What size are you going to take? This is very important. Now, suppose, how do you know that it's working for you, not working for you? First of all, initiate it only twice in a week. Say any 2 days of the week, 3 days apart, Monday, Thursday, for example. Use it in the night after cleansing. If you feel it felt sensitive the first time, then wait for 2-3 more days for it to settle, and then use a little moisturizer, then use your retinol, and then use another thick moisturizer, because retinol can cause dryness.
Oh.
And dryness can cause dryness, flakiness, pinkering of the skin. All this can happen with retinol. So this way, the sandwich technique will help, but it will only in pregnancy and lactation, or if you have open wounds and cuts in the areas that you want to apply. Otherwise, there is no contraindication to it. And it is definitely, give it some time to work. Maximum use it 3 times in a week after you get initiated. And it is a lovely product. You will always, always want to use that as part of. Now, retinol is used in a lot of beauty products, night products. It is to be used in the night. Do not forget to use a sunscreen, because you've made the skin sensitive. If you do not use a thick coat of sunscreen, the area that you have made sensitive is going to absorb more UV rays. When you absorb more sunlight, the more melanin will jump out, and the very reason for which you're treating your skin, that is pigmentation, will get even darker. So do that. Use light colored, breathable cotton dupattas. About niacinamide, it helps in the skin barrier repair. The name itself suggests that it is a barrier that protects us from the external environments. But niacinamide will definitely help them, because they are all the time trying out new products.
Lovely.
So niacinamide will help in kind of continuously repairing their skin. And the third one that I said, hyaluronic acid, you asked me about. The hyaluronic acid is the ground substance of our own skin. It is there in the matrix of our skin. That means the collagen and the elastin that is there. This is the liquid that binds it. And hyaluronic acid, like I said, is a sugar molecule. And with the aging process, with the decline in the estrogen levels, the hyaluronic acid also starts leaving your body.
Mhm.
And like I said, by the grace of God and thanks to technology, there are many injectables that contain hyaluronic acid, the thinnest form, so that it resembles that, and we give them as tiny injections all over and just under the skin, so that it gives you that feeling of a glowy skin, feeling refreshed. And it has to be done, of course, it's not a single treatment, it has to be done several times.
Wonderful. So if somebody has open pores, I would take my example. For example, because I have a lot of open pores on my skin, and I've recently started applying makeup. I used to only put sunscreen and a little bit of compact.
Yeah.
So is there any kind of a permanent solution for open pores?
First, let's understand what open pores are, what pores are. Now, pore is an extension, the outer, kind of extension of the hair follicle opening. Now, the hair follicle has a follicle, the root, and then it comes out. Attached somewhere in between is the oil gland that also pours into the same opening. Okay, that's why when you're younger, the pores are actually, it's elastic. The whole this thing, it has its elasticity. So the oils also come in, and then you see an oily skin because it is coming out through the pore.
True.
Okay, so those are true pores. Now, as age advances, the skin gets dry, the estrogen levels go down, and I'm not talking about you, you're very young. I'm talking about a 60-year-old who comes and says, I've got open pores, and she does have open pores. So what are these open pores? These are the same open endings, but because of age and I think they have collapsed and they have not been able to close. So that's why it's a collapsed kind of this thing. So you see it as open pores and you don't like it because you want it tight. And
correct.
So what can be done? You can do simple microdermabrasion. You can do exfoliation at home, but it's very temporary. You feel good, soft and nice. Then you can do a certain microdermabrasion. It takes away the top dead skin cell layers. You must be knowing about microdermabrasion. Yes. Then there are more, the latest one is the Morpheus 8. The Morpheus 8 got worldwide recognition thanks to Kim Kardashian, and we had it quite in the beginning. And what it does is micro needling. It has different depths. So micro needling, it needles multiple times in the area that is bothering you, and it causes micro channels going deeper, not the pore size. It goes beyond, okay, where the scar tissue is. And in this, we can use actives that we want, exosomes that we want, PDRN we want, something else that we would wish to put, PRP. All these can be used after doing a microneedling. Now, what is MNRF? Microneedling, and RF is radio frequency.
Mm-hmm.
Radio frequency we use in tightening the skin. So, as it is causing the microchanneling, it is causing a tightening also. So that way, it is not a single treatment again. It has got disposable tips. So one tip, you can do about 4 treatments, okay, once a month.
Mm-hmm.
The downtime is, it's very important to know the downtime, because you can tell the client 2 to 3 days you're off. Because when you're doing this, the brain recognizes it as a foreign invasion, and that's how everything works. And that's why a lot of blood is rushed in, a lot of, baby cells are rushed in. And so new collagen forms, and that is how it is slowly filling up. And it is all red the first day, the second day it subsides, and third day you're back to work.
Okay.
It is very important to know for every treatment what is the downtime and when it is going to work and show its effect. Because, for example, the radio frequency, like the thermage, etc., they may take about 6 weeks to show best results. The UL therapy, that is the ultrasound for skin tightening, that again takes that much time. A Botox will take about 10 to 14 days.
Mm-hmm.
The protocol by the company is 14 days. Don't give more before 14 days are over. That's the maximum that it will act. So each thing, so if we do not tell the client, if she has something important, something as important as going for an audition for a film, a Miss India, a board meeting, a wedding, so you better tell them. And that's why it's very important that I try every treatment first, whether I need it or no. One is I'm greedy for treatments, not so much today. But I try everything, even today. I say, if I can take it, I have a great tolerance for pain. I say, if I can take it, I'm sure my client can take it. I can help her with a little more numbing gel, etc. But if I can't take it, I definitely will not, propose. So first thing they ask about pain.
And maybe that is the reason why you do it on yourself, because you want to understand the level of pain and also do expectation management for your patients so that you are able to give them the right answers to the questions that they have.
Absolutely. I need to tell them that itna time lagega. They also want to know each treatment, how much time it will take. Is it going to pain me? What is the cost? In how many days can I go out and it normalizes? All these things I can tell because I have taken it. It's a first-hand information. I do not want to camouflage anything. Our clinic is known for its trust, our transparency. So I feel happy, and that's what I want to be known when I'm no more, that this is the clinic to be trusted.
The legacy that you're going to leave. Yeah. Wonderful. Is it too late to start Botox or any other cosmetic treatment once you're in your 40s or your 50s?
Not at all. It is like, is it too late to start exercise or proper nutrition after you're 40 or 50? Not at all. There is no age bar. I have clients who come for not cosmetic, maybe, yeah, cosmetic in a way, from age 18 to, I have the oldest client who's 92. Oh, so the spectrum is, the spectrum is
wide spectrum.
Wide spectrum. And once, it's a kind of an addictive thing, frankly, Suman. Mm-hmm. So if I have one side of my eyebrow lower than the other, as you can see, no two sides are mirror images. So now, if it goes down too much, and it shows in some picture or in some this thing, then I quickly go and take 2 units of Botox. That's all I need, just to lift that tail of my eyebrow. I'm not saying I don't need more. I need over a period of time. I was the first one to take 26th year of injection from the year 2000. So this is my 26th year of injection. So those days I needed a little more, maybe 30, 35 units. Like I said, we had to tailor it to Indian needs. And today I hardly need about 10 units.
Mm-hmm.
just before some big program or so.
But how much is too much when we have to draw a line? Because, like you said, that these kind of treatments can be addictive.
Very addictive.
So if people say, "Arey, last week ही मैंने करवाया, now there is something else." So
Yes.
is this like a, do people also fall trap of finding fault in their faces to go and take treatment?
To be very honest, when they are convinced about what we are saying, we do whatever little that we have to do, because we always, if they have time, we give them a roadmap,
Right.
a timeline. Like, let's do it this way. It helps in many ways.
Mhm.
So when they do the first treatment and they love the results, then they start looking at all other places. And so I think that's human nature. So they said, "Ye theek ho raha hai. I'm looking so much younger. What doctor mentioned to me, maybe I should go and get that done."
And do they get greedy that I want more?
In 31 years, I don't think a single client will say, they may say we are a little expensive than others, but there's not even one client who will say that we've been misguided, or so they trust in us completely. And so when they come to us, and when you say, first of all, I say to many people, you don't need anything at all. They come and remind me 2 generations later, now the third generation is coming to me.
How?
So they remind me, "Doctor, when I had come, you had told me, just go away and you don't need anything. Your skin is very nice. Just, moisturize it. So, and use the sunscreen." But having said that, I forgot what I was saying. I digress so much.
Do they ask for more?
Yeah. So they definitely ask for more, and then they say, "Aur thoda dalo. Mera chin, I want like someone, or thoda dal dijiye." I said, "No, it's not going to look nice at all." And today, the whole concept of fillers and everything has changed. Just like a plastic surgeon would cut from all the sides and give you a facelift, a mini facelift. So our fillers that we are using, we are not using here unless they have, gaddas under the eyes. They have hollows.
Right.
Or if the Indian chins, by and large, are really short. Are really short. So if just for the completion you have something left, you'd rather put it in the chin and make them happy. But we never put it here. I'm sure you don't have it here, but you've got lovely cheeks. You've never put fillers here. Yeah, so me too. Me too. Though I'm saying that I have kind of dabbled with everything, but I've never put fillers here, because since my birth to date, my mother, who's 92, 91, and me and both my sisters, we all have these cheeks in our family. So if at all I want to look better, I'm going like that, and I'm putting my fillers here. You can just see, and I'm putting my fillers here, and you can see the change.
Right.
You can see the change. I don't know whether I'm holding it correctly.
Yes.
So we put the fillers all here. Then if there is a concavity here, we put the fillers here, so that there is a seamless transition from your forehead up to your chin.
So you can actually shape the whole jawline.
Totally.
And the entire
Yeah, totally.
Of the whole face.
And I think for that you need to be artistic.
Right.
You should know a client has just 1 ml to spend on. Now 1 ml is a teaspoon. Those who have little kids know that a teaspoon, or even me know, is 5 ml. So out of that, we're taking 1/5 of a small teaspoon. But because it is cross-linked, and because it has been given that body to lift with very tiny amounts, with one syringe, what best can I give her?
True.
There you need artistry.
Absolutely.
There you need total artistry.
Absolutely.
Let me give her a little point here. Let me give her a little chin here. Let me give her, there's a dent on her nose. Let me put that little bit here. She's happy. She doesn't look different. Her husband even doesn't recognize the changes.
I think that's the real beauty in true sense, if you have to do it from the aesthetic point of view.
Absolutely.
Amazing. What is the best anti-aging treatment to start with when it comes to a preventive treatment to begin with?
You're talking about anti-aging treatment. That's why I can't say, embrace a great lifestyle, because that is the biggest anti-aging.
Absolutely. I totally agree.
The skin, your body, your shape, and everything is defined by how many hours you sleep. Recently, I read where a poll was taken from all the experts in anti-aging, and the top of the list was sleeping for 8 hours every day. So sleeping repairs the wear and tear, during that time that you're resting. And then, of course, there was exercise. As you age, doing weights making sure there's a lot of protein in your diet, exercising we covered, drinking a lot of water, emotional stress, handling that. So, pranayam, yoga, all these things, which may seem, because we've heard it for centuries, it may seem that in today's context, yeah, it's good, I do yoga for, but what it is doing to your inside, centering you as a person. So, all this is anti aging. It shows a person doing yoga, I can tell a person lifting weights or doing exercise or running, I can tell as soon as they walk and they've come here for the first time. I said, you don't have to tell me about the fitness. But still, I said, for my record, just let me take it.
Are there any aesthetic treatments that are permanent? Because a lot of times we keep hearing that this treatment will last for 6 months and this treatment will last for 1.5 years or 2 years. Do we also have anything that's absolutely permanent?
Yeah, you're absolutely right. There's nothing permanent. All our treatments that we do, for example, like we already mentioned, Botox lasts for 4 to 6 months. The skin tightening, whether it is the ultrasound or the thermage, that is the radio frequency, we have different companies. Some require to do it many more times in a year. Some just once a year is enough, but nothing is permanent.
What about hair transplant?
Hair transplant, the hair that is transplanted is permanent.
Okay, wonderful. That is something that is permanent.
Otherwise, the only thing that is permanent is your positive thinking. Honestly, it may sound cliched, but I believe in one sentence. I had certain losses, personal losses and all that, my husband, etc. And over the years, I realized that there's one sentence that keeps me going, that makes me almost work in 3 shifts. From here, I have to go somewhere else at this age. I'm 71.
Wow.
So what keeps me going is that things could have been worse. Of course, not relating to my husband, but otherwise, in every this thing, I apply that, and then it gives me solace that things could have been much worse.
And I think the most important thing which works for everybody, women, men, everyone. And when you said that you are 71, what keeps you going, first of all, is the sense of purpose, because you have such a big responsibility of making people look good and feel confident about themselves.
Yes.
And that's a very big responsibility, because today people, especially when we talk about women, for example, the biggest pandemic today is poor self-esteem and low self-image.
Yes.
And that is where you and I come together.
Correct. Absolutely.
Where we have to repair these issues from the grassroots level. And this is where our responsibility multiplies.
Yes.
And for me, I would always say that this keeps me absolutely going and young. I'm 50 today. But at the same time, I feel so energetic from inside that there is so much that I have to do. I mean, I can't press the pause button at this point of time, because
me too.
Because
there are vendors who are like in their mid-30s and all, who come. Senior vendors come to me because I'm the senior most. They must be 40, and then they meet me only after I finish my work, which is about 7:30 in the evening. And then they come in, and then I tell them, oh, you must do this, or this is a great idea, or you must start this one, each one teach one, or something like that. All my wild ideas. And with this kind of a gusto. And then they're saying, ma'am, where do you get the energy? They're saying at the end of the day, we are all so tired.
True.
And I can't see myself, I hope so, another 10, 15, 20 years later also, because I can see my mother is genetic, I think. At 91, if there is a birthday party of my granddaughter, she has to have everything matching.
Wow.
She has to have a bleach done, because she's got at her place someone who comes and gets it done. She has to get her eyebrows done. I mean, really coming to your show, I thought I'll just, detan myself a little bit. I've got the Q switched NDAG. I said, let me quickly do it. It takes only 20 minutes, no downtime, nothing. I didn't get time because last 3 days I've been doing this. So, but she's very particular. So I see myself, my memory, for example, at age 70 last year, I had to appear for my DHA exam for Dubai in order to practice there.
And I think all these people who give so many excuses to not do things at this age, they procrastinate. I think
absolutely
they need to learn a lesson. They need to actually walk the talk by listening to what you have accomplished over a period of so many years.
We have freshly graduated medical students appearing with me. and they're there at the second attempt, and also God is great.
And I would definitely say one thing, that if you want something that you've never got, you need to
Absolutely.
do something that you've never done.
Absolutely. Because we have challenges every time you think of something new. There are challenges in life. So yesterday I had to say I got some icon award, and I had to say, then I said, when there are challenges, but if you pursue, you lead with passion, with perseverance is very important. You can't just give up because it's not working,
Absolutely.
you know, and that it is not impossible to achieve. In fact, it becomes inevitable that you achieve.
And none of us were born with a silver spoon.
I
We all
wasn't.
learned it the hard
I
way.
wasn't,
Yes,
definitely.
yes.
My parents gave us a good education. My mother, inculcated the values, and that is what has kept us going.
Amazing. So, Doc, are there any cosmetic procedures for women who are pregnant? Because a lot of women who are in their pregnancy also want to look good in
Yes, of
terms of their
course.
skin, their self presentation. So, what do you have for them?
So in pregnancy, injectables is a complete no-no.
Yes.
I tell them honestly. They bring me literature. Actually, I can in fact name. She'll be seeing it in the U.S. My friend Diana Hayden. I said no to fillers. I said no to Botox when she was pregnant, and she was ex-Miss World, and now she's in the US. She came with she reads a lot. She came with lots of research saying that both of them are okay in pregnancy, fillers, this thing. So I applied my mind and I said, yes, is a sugar molecule, okay? Fillers contain hyaluronic acid, should not, even if it crosses the blood barrier, should not affect the kid in any adverse ways.
Mm-hmm.
So, and she showed me actual studies. But when it came to Botox and she showed me studies, I said, no, this is a neuromuscular, kind of a treatment. So, where there is nerves and muscles and all involved, I said, before a baby is born, I don't want that baby to be subjected, even, I mean, whether it crosses or not. I said, so till today, but even fillers, that's why in our clinics, in every room, even in facial rooms, medifacial rooms, we have put everywhere, please inform us, because till fourth and fifth month they
Right,
dress
you
so
are not
well,
even
you
visible.
really can't make out. So there are certain tiny machines that we can use, like a hyaluronic acid that spreads the hyaluronic acid. All those we can use, but anything that has currents passing through it, we
Any
don't use at
invasive
all.
treatment will
Any
not be
invasive, definitely
recommended.
not. Yes, but we can use uh, a mild microneedling with not exosomes, but maybe with hyaluronic acid, with their own PRP. All those would be safe for them, so that they feel that they are pampering themselves, and but at the same time, be if they go to good physicians, then
Right. How about girls or women who have PCOS or any other hormonal disbalance? Can cosmetic treatment take care of those issues also?
polycystic ovarian disease or syndrome is so common today.
Right.
Maybe because of the stress factors in youngsters. Today you must have heard of Sephora kids, girls at 9 years coming with so many step treatments. They come with their products. So the world has gone completely crazy with online information. So there has to be someone guiding them. They have to go to their doctors who will wean out the products, because at that age it is very important to protect, at 9. But coming back to, yes, as a girl enters my consulting room, 99% of the times, I can tell whether, I won't say that she has a polycystic ovaries, but that she definitely has hormonal imbalance. And, mainly it is the raised male hormone, which happens in PCOS also. So now, how do I know that? She comes in, sometimes, the hair all frizzy, thinning of hair even at 18 or 19, because you expect the head to be full, and then a dullness of the skin, despite being from a good background, despite a good dullness of the skin, acne, then
Acne
hair,
usually here,
yeah,
hair
no,
here.
hair in male areas of hair distribution. That means, where does a man normally get his? I mean, these are the areas, sometimes around the nipples, in the midline below the umbilicus. That is after on examination. But as she walks in, you see all these signs: hard hair on the limbs, on the arms and the legs, which if she's trying to wax, it goes into ingrowths and little marks.
Right.
So all these are parts of, sometimes yes, most of the times no, periods are not irregular. Even with regular periods, you get all these signs of polycystic ovaries. And then we give them a whole panel of tests to do, whether it is a stress hormone that is causing all these changes, because they're identical changes to PCOS. We do the male hormone, this thing, we do the female hormone pattern. We see the ratio male to female hormone. There is a reading. So from that, we come to know, and we do a pelvic sonography, which is external, painless, less than 5 minutes. And it's best that they do, so that we know that this is the cause. Once you know the cause, then treating becomes easier. So what are the cosmetic treatment? Laser hair reduction, because it takes so long. And if the underlying cause is not treated, then it keeps on sprouting more hair.
Right.
It doesn't give you the results. So it's best that you know, you try and treat that. Take the help of an endocrinologist, take the help of your gynecologist, have a team that is looking into it. And when it is being treated, then the laser, because the cause is being treated, the effect, it shows easily. There is nothing like laser hair removal. If it is thick, then that much more laser energy is absorbed by the hair root, and sometimes it goes. But otherwise, it is only a reduction that has to be explained, and there have to be multiple sittings, 1 month apart, and between two laser sessions, the skin has to be, the hair has to be shaved.
And I can vouch for Skin Lab's laser treatment because all my lasers have been done by Skin Lab.
Thank you so much. Thank you. How sweet.
So, what are some superfoods that you would recommend for somebody to have, like wonderful skincare as a part of skincare regime? What are the foods that can be recommended?
So, foods, eating the right food is extremely important to maintain the gut microbiome. I think it is a whole subject, so I will speak about it at another time, maybe. So, frankly, I will say it in a short because it's close to my heart. When the embryo is formed, when you conceive, from the endodermal layer of the embryo, the first thing that is formed is the digestive system, the gut. Okay. Now, from this gut arise all your other systems and all your organs. So, when you say, I've got arthritis, check your gut. Why? Because the limbs have arisen from the gut. So, anything, so there is the gut brain axis, which is very important to understand. Then, if if you're not having enough fiber, if you're having wrong kinds of foods, if there is stress of all different kinds, emotional stress, there can be environmental stress, there can be cellular stress, there can be stresses at all levels. All this stress manifests into an inflammatory disorder, and this can wreak havoc with the lining of your stomach. It leads to leaky gut and many other problems. Now, so eating right becomes very important.
True.
Okay, because then when you're eating right and your gut is fine, all your other organs seem fine.
Absolutely,
Right?
absolutely.
So what are the superfoods? All foods rich in antioxidants. What are antioxidants? I think everybody knows, but they go and they engulf the free radicals that are formed when all these stresses are there, making the system inflammatory or acidic. Like I say, I wrote it in my book. When your system is acidic, when your tissue is acidic, all diseases from cold to cancer is because of that. So if you're treating cancer, I have a close relative who's fighting cancer, and what she's doing, her whole aim is taking out the inflammation and the acidity from a system and changing into alkaline.
Wow.
Now coming to superfoods. So what are the foods? Foods rich in fiber, foods that are deeply colored. Now, which are the foods? That all berries, peppers, carrots, beetroot, and mango, papaya, all of these deeply colored fruit and vegetables are spinach. They're all rich in fiber as well as antioxidants. So they help. Besides that, the nutritional supplements, if you need, high protein diet will help make you stronger. And In the superfoods, we need oil such as omega-3. We need a natural listing, which we can get in avocado, in certain nuts, walnuts, almonds, seeds, non-vegetarian, of course, very rich in protein. Try and avoid red meats and lots of water.
Wonderful. How does stress show up on your skin? Because this is something which I think everybody is concerned about, because today we are living in a world which is full of stress.
Totally, totally.
So, how do you actually uh, identify skin which has a lot of stress? And what do you do for that?
When you're very stressed, you get conditions like it may start with a rash. Acne rosacea is connected with stress. People who are type A personalities, who have IBS and all that. So then it shows in the form of acne rosacea. There is seborrheic dermatitis, flakiness, itching in the scalp, big flaky dandruff.
And
Then
I think also patchy hair, because
patchy
sometimes
hair, you're right.
alopecia.
Alopecia areata is another condition. It is an autoimmune condition, but it is stress oriented. And so also acne. Having acne could be hormonal, but the very fact that you're having acne, you're stressed completely, and insecurity or within yourself, you have to learn to be happy, do whatever best that you can
I think it
within
all boils
limits.
down to self-image.
Yes. So, if your self-image is good, then so much of your stress or tension is less.
Right.
And when that happens, then it's a vicious cycle.
True.
Because stress is in any case showing in the form of obesity also.
Absolutely.
Yeah, in
That's
forms
a
in
big
all
reason
kind.
why.
Yeah. So these are all flags that we have to pay attention to. Always in today's day of technology, today's day of genetic mapping and so many all kinds of tests, it is best to know where you stand, what can help you. So many experts in the field. I mean, you really can be what you want to be and really be happy. Don't cross lines. Be happy in what you can do with the minimal of help.
Very true.
Don't ever feel afraid to seek help. You need psychological help, go to a psychologist, discuss your problems. I do psychology in my own way, because when clients come with smaller problems which look mountainous to them, I tell them about my problem just as a comparison, and then they're quiet, because
And
things could have been worse.
so, which means that you also counsel people when they come for treatment,
Of
because
course, it's very
because
important.
as a doctor of taking care of aesthetics, your added responsibility also is to look from within, that how healthy they are from the inside, so that you are able to work on their outside. So I
Correct.
think that's an added
So,
responsibility.
what their food is, how much water they drink, what is their form of exercise, what is their age, of course, and all these things. What are the nutritional supplements that they're taking, in which we can help them? Any questions that they have about drips, about anything new that is in the market. So, helping them correctly, I think, and what is where to say enough? You look really lovely. Don't do anything more.
We've now come to the last question, doctor. And the question is, what is that one myth about skin treatments or cosmetic procedures that you would like to bust today?
So, skin treatments, whenever you feel that you feel a need, go to the right person, the right doctor. How do you know he or she is the right doctor? See what your friends say, people who have taken treatments from them, and then choose your doctor accordingly. And take advice. Learn to stop where you have to, because at the end of it all, you want to be looking fresher, you want to be looking younger, you want to be looking less tired, you want to be having a happy countenance and the best version of yourself. You don't want to, some people bring photographs and say that they want to have lips like that, and they may be having a wide mouth, and they're showing me these rosebud lips. So you cannot. You have to be the best version of yourself.
Correct.
So it has to be the right person guiding you. So I think that is what. And about cosmetic procedures, you better tread with caution, because if it goes wrong, then there's very little one can do to resurrect what you were before.
And I think the most important thing people need to understand is, first of all, learn to love yourself.
Yes.
Embrace self-love, and also learn to accept that cosmetic procedures or aesthetic treatments are to support the way you look.
Correct.
Support your
Absolutely.
aesthetics. And
Enhance
learn
what you
to
have.
draw a line. Don't go overboard with treatments, because I also know people who have gone overboard and now today they look absolutely plastic.
Different. They look different.
Very different,
They
very
can't smile
plasticky.
properly. They can't lift. You know, expressions are needed. I always tell my clients, I said, when you're upset, either with kids don't listen these days, but at least with your staff, when you're angry, if you don't have lines, how are you going to show? I mean, on a lighter
Correct.
vein. So you need your expressions at all times. So do whatever it makes you happy. Be happy in your own skin.
Learn to understand how much is too much, or
Yes.
how much you have to do for your skin, because the other person may have different needs, you may
Correct.
have different needs.
Yeah.
Work according to your needs for your skin so that it works for you and not against you.
Absolutely. You
So
put it
this is something which is
absolutely.
very, very important. And with that, I would like to really thank you, Dr. Pai, because
Thank
this
you, Suman.
conversation was much needed. And I have been waiting for this for a very long time, because
Thank you,
pioneers
Suman.
always bring a lot of value with them.
Thank you. And one pioneer speaking to another one, and hope someday that we can do something
Of
together.
course, of course. We
And-
have to and we will.
Yes, we will.
That was a deeply insightful conversation with Dr. Jamuna Pai, a pioneer who not only reshaped the aesthetics industry, but also how we think about beauty, aging, and skin confidence. If this episode helped you understand your skin, your self worth, and your options, better do hit the like button, share it with someone who needs to hear it, and subscribe to Perception and Beyond. Because the way you feel about yourself should never be limited to perception, it should be empowered by truth. See you in the next episode.